healthcare is broken, but it can be democratized.
Welcome to the MMC Ventures podcast. We're going beyond the hype in artificial intelligence. A warm welcome to listeners. I'm David Kellner, partner and head of research at MMC Ventures, the insight-led venture capital firm based in London. In this 6-part series, we'll be hearing deep insights from some of the world's leading AI technologists, entrepreneurs and corporate executives, while keeping things accessible for the non-specialist. I think AI is today's most important enabling technology, but it's not easy to separate fact from fiction. My goal for this series is for us to come away better informed about the reality of AI today, what's to come, and how to take advantage. This series is sponsored by Barclays. I asked Barclays for a strapline they'd like to include as sponsor, and I thought their response was really interesting. Quote, "Many thanks. We're not sure what to have as a slogan. Here's how we're thinking about AI. We think AI is incredibly important, a whole new field that's as significant as anything that's gone before, and we think about it a lot. We think AI is vital to our business, and we're working hard to take advantage of it for our customers. And we need to learn from and collaborate with a wide range of people to ensure success. We think technology advances fastest not when it's held close, but when people go out, listen, and contribute." I thought that was actually better than any slogan, so I asked if we might run with that, and I have pleasure in doing so. I'm delighted today to speak with Dr. Ali Parsa, founder and CEO of Babylon Health, one of the leading AI companies in the UK and globally. Babylon's on a mission to transform healthcare worldwide. I'm excited to talk with Ali today about AI, the impact of AI on healthcare, and Ali's experience as an AI entrepreneur. Ali's an entrepreneur and engineer by background. Prior to Babylon, Ali founded healthcare provider Circle, which grew to become Europe's largest clinical partnership with £200 million of annual revenue and 3,000 employees. Circle also enjoyed a successful IPO. Ali was named by The Times as one of the 100 people to watch globally and was recipient of the Royal Award for Young Entrepreneurs by founding V&G earlier in his career. Ali's also a UK Cabinet Office ambassador and has a PhD in engineering physics. Ali, a very warm welcome.
Thank you very much.
I should mention to listeners that prior to joining the venture capital world, I worked with Ali from Babylon's earliest days as the company's CFO, and as a result, I'm a small shareholder in the company. Ali, I can tell you that the company's current office is a much better environment than your garden shed in which we started, so things are clearly going okay.
We're incredibly sad to lose you, though.
Well, look, let's start by learning a little bit about Babylon. Tell us about Babylon. What's your mission?
So we started Babylon to try and do with healthcare what Google did with information. Make it accessible, affordable, put it in the hands of every human being on earth. That was our mission the day we started. It remains our mission today.
The Babylon app makes it easy for people to speak to a GP using their smartphone. You're also developing artificial intelligence to diagnose illnesses. Why did Babylon evolve into an AI-first company?
If, David, you think about accessibility and affordability of healthcare, as long as I can deliver most of the healthcare most people need on devices most of them have, that's highly accessible. The problem becomes affordability. How do you make healthcare affordable? And to do so, you need to understand where the costs in healthcare are. And the costs sit in two fundamental buckets. One, it's people. 2/3 of all the money NHS, for instance, in Britain spends on healthcare, it goes into salaries. And that number is almost true also in Rwanda, and it's almost true in the United States. So I can cut the cost of healthcare in every other area, and by the time I've done so, the inflation has eaten into that. Second big bucket of cost is timing. Most diseases, by the time they manifest their symptom, a $10 problem has become a $1,000 solution. In both of those areas, the only true solution is to use machines, artificial intelligence as you call them, to enhance, augment the ability of humans to deal with more of the problems that we have in order to reduce the cost.
One of the implications I think AI will have is to enable services to be scaled to an extent they haven't before by automating activities that previously could only be undertaken by people. The lower costs and better accessibility that result might enable whole new subsets of the global population to access services like healthcare and financial services for the first time. Is that the kind of impact you're describing?
You're absolutely right. For you and I, healthcare is available and it's accessible. It's expensive, it's inconvenient, but it's there. For 50% of the world population, there is no access to healthcare. People forget that all these $10 trillion industry that is healthcare today, it's only actually for the minority of human beings on earth. Vast majority of people have very little access to healthcare, and almost half have none. But yet they all have access to a mobile phone. So if we can deliver through the platform they already have the healthcare they need, we will open this market to every human being on earth. You're absolutely right.
Can you tell us specifically then how you use machine learning technologies at Babylon to achieve some of those benefits of cost reduction or of accessibility and scalability that you described?
So let me explain to you what we have built because people talk about machine learning. There are different branches, of course, and techniques in artificial intelligence. A better way of thinking about this is, what is it that we create? If we create an artificial intelligent doctor, we're basically replicating the brain of a doctor. So what does a brain of a doctor contain? We send a student to university and they learn. We give them a knowledge base. So we have created in here what is today probably the world's largest knowledge base in medicine, certainly in primary care, with over 530 million strings of knowledge. No human brain can contain that many, at least accessibly, immediately. Second, a doctor talks to you, interacts with you to take information from you and to convey it to you. So we have created natural language processing understanding generation capability in here that can understand medicine. So for instance, when I say my tummy is killing me, it understands it means my stomach hurts, and it doesn't call the police. The third thing is a doctor then collects that information and infers from it. It logically decides what it is that is wrong with you. For that, we had to create what is today, I understand, the world's largest Bayesian network, the largest probabilistic graphical model that ever existed. And it's natural that it should be there, because you look at the combinations of symptoms and risks and history you can have. It's billions of variations that we are trying to assess to set the probability of what disease you can have. We had to build that, and we had to build it in a Bayesian network and not, as they call in deep learning, because it needs to be auditable. I cannot say that, hey, the machine said that's your disease and I can't know why. So it had to use a particular technique as opposed to another. And then a doctor says, okay, so that's your disease, and let me now tell you, if you don't fix it, here is going to be your future. It's what we call in artificial intelligence predictive analytics. And then, of course, a doctor every time learns from their interactions with patients. That's why we call it practice. And that's the part where the machine learning comes. So the machine learns from every interaction it has.
Pretty much every stage of the clinical process you're replicating in software, but using cutting edge techniques.
And you have to do that. So you can't do this in a little piece, because my body and the knowledge base and the interaction cannot be a piece of that together. And also, you can't do this in a vertical in medicine either. One of the problems with medicine is that there are many silos. And after I unfortunately lost my father-in-law to diabetes, and he had a wonderful doctor who will deal with his eye, and another wonderful doctor who will deal with his feet problem, and another one who deals with his back problem. But the problem is, he's a one single human being. How do you create a machine that avoids the silos in medicine by being excellent, by looking after you everywhere? 40% of people with diabetes have depression of one form or another. How do we deal with that? And that is why when you build a machine in healthcare, it needs to be a comprehensive end-to-end solution, which makes it a very expensive, difficult thing to create. But once you created it, it's a wonderful thing to have in the pocket of everybody.
It's well understood that one of the challenges of deep learning, of artificial neural networks, is this explainability problem. We know that deep learning AI is really good at finding patterns and making good predictions, but we just don't always know how it does it. You mentioned a little earlier about why you use Bayesian networks. Is it precisely because of this concern around explainability?
Correct. And there is also other reasons for that, right? So we also need to have, in deep learning, you need to have enough data sets, reliable data sets, in order for the machine to learn. And in medicine, when the great team in DeepMind won the game Go against the world champion, They train the machine through a very large selection of games that the machine played, but the rules of the games are written in 2 paragraphs, give or take, of the game Go. The rules of medicine are not even written in 2 volumes of books, and there is not enough data in the world to teach a machine just randomly how to become a doctor. You need to curate that knowledge, and you need to teach the machine. So there are other reasons for using the techniques we use, and we do use a lot of deep learning, but we use it in other parts of our business. We use it in language, we use it in interactions, we use it in other parts.
So it's not like a lot of the natural language processing presumably is deep learning based.
And in pattern recognition.
The other point I just want to pick up on, you described toward the end there a whole view of the patient, a more holistic view of a patient that's required in healthcare to give results. Do you think there's a kind of more profound paradigm shift happening here, a profound opportunity longer term, where not just AI can do what a human doctor does better, but AI could do what a human doctor could never do by having the ability to truly have a fuller, more whole view of a patient through data that any individual or any system could never have? Or am I getting overexcited about that?
No, you're absolutely right. Where we are going will be far beyond the capability of any individual doctor. There's no question about this. The brain that we are building, it's not just the brain of a GP. It also eventually will become the brain of many specialists. The machine can become a great orthopod, a great GP, a great psychologist at the same time. It will also be the brain of a foreign doctor because it will be serving patients in different countries, and it will learn from those back into. It will track you. It will be with you all the time. It will look at all your information that you're prepared to share with it. What we're building today, it will be a fraction of what its capability will be only in a couple of years from now. We never share what we do beyond 3 to 4 months publicly. But when I look at some of the projects the teams are doing that should come to market a year from now, it just brings tears to my eyes sometimes to think what the limits of the possibilities are here.
We'll talk about the impact on healthcare in just a moment, but with regard to the technology, what are the biggest challenges you encounter when developing an AI capability?
I think when you are going into uncharted territory, you actually never know what is going to be your biggest challenge.
You don't know what.
And the beauty of science is once a problem is solved, it's behind you, and therefore you move on to the next issue. Our current challenge, as you were saying quite rightly, is that the size of the network we had to build is so large, and the number of decisions we have to make or it needs to compute, it's so varied and so immense that the processing power of computers are at its limit in order for us to be having a natural conversation. There is a latency that we are trying to overcome. So when we sometimes hear people say, oh yeah, there is another group of people who do something like this, we sometimes wonder, we know it cannot be true because we know what it takes to get there in terms of sheer size. I am actually glad to say that it looks like we've just managed to solve that problem. We're implementing it now and we'll know shortly. But if we've done that, that is one of the frontier problems of computing that the scientist team in here has managed to overcome.
Talking of talent, it's widely understood that talent is such a key enabler of great AI and is in short supply. How do you attract truly world-class AI talent?
Look, I think world-class people need world-class problems to solve. And we are incredibly lucky to have a mission that attracts wonderful human beings who want to solve a great problem. The reality is that there are many other companies who deploy artificial intelligence in great size, but often at the end, the final purpose is to sell more advertising to people. That's it, right? And it is not that difficult to persuade people to solve one of the biggest problems humanity faces rather than to try to chuck more advertising in front of people's eyes.
What's most misunderstood about AI today?
Oh, everything. I think, 4 or 5 years ago, David, when we started Babylon 3 years ago, if you were not a social network, you didn't exist. And then it became an on-demand economy 2 years ago, and now is AI. And because the knowledge is so low, I'm sometimes get so shocked by people who just have a very basic rule base somewhere, and they say, now we are an AI thing. And as people like you do what you're doing, which is to educate what actually artificial intelligence is, it takes that noise away. But I'm hoping that eventually every technology company will become truly an AI company, because I don't think artificial intelligence is yet another technology. I think it's a game-changing technology, and it will have what it deserves.
Should we talk a bit about the impact of AI on healthcare specifically? Let me start with a broad question. How do you think AI will impact healthcare overall?
I think it will change everything. We are on the verge of being able, as I said at the very beginning of this conversation, to put healthcare into the hands of every human being on earth. Never before on the face of the planet that has happened. And we're not going to put healthcare in the hands of everybody on earth. We're going to put eventually the best available healthcare. We're going to do with healthcare when I said what Google did with information, because it doesn't matter how rich or poor I am. It doesn't matter whether I am in Baku or in Baltimore, in Kabul or in Connecticut. I have access to the same information through Google. That is just not true about healthcare. The rich have much better healthcare today than the poor. It's not even the same league of healthcare they have. And I think we can equalize. We can truly democratize that. We can make it possible for a peasant in India to have exactly the same access to diagnosis to start with and healthcare eventually that the rich in Washington or in California have.
In addition to better provision of primary care, which parts of the healthcare system do you think are most ripe for disruption?
I think every part of healthcare will be disrupted. Everything about healthcare, it's about to be disrupted. And it is. Like it used to, you just look, and it's happening in front of our eyes. It used to cost me $1 million to diagnose you only 10 years ago, 12, 13 years ago. Today I can do that with $10,000, top to and throw in your genome sequencing. That is a 99% reduction in cost of diagnosis. You look at intervention, everything from synthetic biology to electrobiology, from nano molecular engineering to organ reconstruction. We are to genetic therapies. We are fundamentally changing all the frontiers of medicine. And I think while my grandparents, give or take, received exactly the same kind of healthcare I receive today, my grandchildren will not recognize the industry we call healthcare today because it will be fundamentally different.
Which dynamics in healthcare cause you as an entrepreneur most difficulty? It's not an easy space.
No, I think the vested interest that protects the old system in healthcare is the worst enemy of healthcare innovation anywhere in the world. And I think it is a ginormous shame that we forget how much problem we have with the existing model of delivery. And we try to protect, even our regulations are about the protection of the old system. So for instance, when somebody comes, even from Care Quality Commission in Britain, come and check safety, the fact that I have to wait 2 to 3 weeks to see a GP is not part of the system of checking safety. So if you think about it, right, the very basic, the fact that I have to walk into one of the most infected places on earth, the GP surgery that many other people with diseases have come into, is not part of safety check. It is fascinating to me how much the old system defines our ability to innovate.
Let's talk a little more about the healthcare ecosystem. In most sectors, regulatory bodies don't understand AI very well. It's very new. I think it took 10 to 15 years for the last generation of computer-aided diagnostics to work their way through regulatory processes in healthcare. How do you think the regulatory environment will evolve in the coming decade?
I think that is an excellent question, because you put your finger onto one of the biggest breaks that the vested interest in the existing system of healthcare can apply onto innovations and disruption of the industry. And it can play both ways. We are seeing some fantastic signs in FDA and in MHRA, whereby healthcare innovation is being seen as a priority. And the regulators are trying to work hard to understand. And we are seeing a lot of pressure being put on the regulators. And in some regulators in Britain, for instance, we see sometimes the very basic they can't get their head around it, not in MHRA, but in other regulatory things. I think this is going to be a world of two halves. There are going to be those regulators who will enable their country to become at the forefront of innovations in healthcare, and there will be those countries who will hold it back. And I think the countries who will hold it back, unfortunately, will fall behind, and the countries who don't will become the champions who will create and host companies who will become the global leaders in one of the world's largest industries.
Can I sort of push or challenge you a little on that? To what extent do you think regulatory concerns, regulatory headwinds are a function of old school thinking, vested interest, etc., versus a real recognition that to an extent this isn't an industry where, as fully as in the case of others, one can move fast and break things because the things you're breaking are people? Do you feel there's balance there, or would you challenge that?
I think I would challenge it because it assumes we're not breaking people.
Interesting. So you think the status quo is
the
such
status
that we're breaking people?
It's incredibly bad. We are all got used to it. In Britain this month, I think around 1,000 people will die of what we call avoidable mistakes. 1 in 4 of us can't get to see our GPs at the time we need to, 1 in 5 of us. 1 million people a month do not get to see the consultations they want to receive. That is Britain, one of the richest countries in the world with one of the better health systems. Half a population of the world have no access to healthcare. People are dying for very simple things. And that is in physical health. If you have a mental health problem, even in Britain, we ignore you, we deny it to you. 60% of our kids who are in jails are people who had simple mental health issues that we didn't deal with until that became a much bigger problem, be it in addiction or other things. So the current model is broken and it needs to be fixed. However, we spend $10 trillion a year on it, and that $10 trillion pays for a lot of vested interest. Having said that, you're absolutely right that we cannot allow a game of snake oil salespeople in here either. Things need to be tested, they need to be verified, they need to be authenticated, and we need to make sure that we don't let loose things that will hurt people. But that means we need to make regulation not a barrier, but an advocate of technology by making it fit for purpose. Unfortunately, much of the regulatory bodies we have currently just don't have the personnel who understand what they need to do. Often, you look at even our Care Quality Commission, unfortunately. How many people do they have in it who actually understand technology? How many of them are not GPs of retirement age?
A little more on the healthcare ecosystem. The biodynamic in the UK is obviously unique given the presence of the NHS. What are the dynamics of selling to the NHS? Maybe what advice might you give to entrepreneurs to help them kind of navigate that challenge?
I used to be 6'4", blue eyes and blonde hair, and I now look like Danny DeVito. And I wish I knew the answer to that question. NHS is not a single body. It's a collection of many hospitals, many GPs, many commissioning groups. Some of them are at the forefront of innovation anywhere in the world. They're wonderful people who are trying to do the best and are hungry to find the most innovative thing that solves their problems. Some are not like that. My thing is find your champions, locate them, work with them. The truth is vast majority have their heart and their mind in the right place. They're sometimes fearful, they're sometimes scared, they sometimes know that if they make a mistake, the whole system goes down on them. So you need to be patient, you need to work hard, you need to accept setbacks, you need to know that the system will push you back. But eventually, if you keep at it, you will win.
There appears, to me at least, to be enthusiasm for digitisation and innovation at the highest levels of the government. What are the dynamics, though, of translating that into frontline deployment? Because I imagine there can be some reality gap in between. Just tell me a little bit about what that looks like.
As I was saying, the picture is very patchy. So there are those who take what they hear from the leadership on innovation and implement it. There are those who put brakes on it. There are those who have a whole series of varieties of interest that makes them not want to do it. And some of those reasons are very good, and some of those reasons, unfortunately, are things that we need to stamp out. But I don't think it's a unified picture. And I don't think, by the way, any other country is any different. I think any country, if disruption was easy, then we will all succeed. It takes time, effort to build something, especially in an industry as established as healthcare.
Let's talk a little bit more about the dynamics of AI technology in healthcare. To what extent do you think users will be willing to trust AI-based diagnostic systems?
I think people will be skeptical until they almost trust it, and then they will absolutely trust it. So it's like everything else. We were skeptical of using phones for 50 years. The Victorians didn't use phones until they did, and then it became ubiquitous. And with AI, we are, when 20 years ago, almost to date, or to the year, where a computer beat Kasparov in the game of chess, nobody thought it could happen. And then when it happened, it was immediate. People said, well, that's it. Obviously, a machine can do that. And I think that once machines start diagnosing, for instance, as well as humans, and people try it and test it and experiment with it and see it's true, and then go check with a doctor who says the same thing, eventually everybody will do that. I actually will go further. I believe, knowing what I know and knowing what we're building, in 2-3 years' time, and maybe that's 5 years' time, maybe it's 1 year time, but in short period of time, it will be untrustworthy for a doctor to diagnose you without the use of artificial intelligence. It will be actually, in my view, negligent, because no human brain can deal with the complexity that a machine can, and will never have the precision the machine eventually will.
Beyond triage, when do you think reliable, fully automated diagnoses of most conditions, an AI GP, will be a reality?
Today. We have it here, now. BBC Horizon program came here in June, brought their doctors, they tested it, and a product that we will launch shortly will, for 80% of all primary care diseases, will diagnose you very accurately. We can already do that in our machines here. The only reason it's not in our product yet is those boundaries of computing that we are saying that we have to push to make it a experience that you readily enjoy or act with. But the science is solved. We've solved a scientific problem. It's not an engineering problem we need to solve. And I'm sure other people are doing other things in other areas like this. There is a lot of claims which make the scene a little bit confusing for people, but some of these will come true, and some of them I know are already coming true. But that problem that you just said about diagnosis for most conditions, that problem is solved now. Scientifically, that problem is solved.
Do you think developers will have more impact on healthcare in the next decade than doctors?
Yes. In the same way that I think machines are starting to have more effect on communications than journalists did. And algorithms are having bigger effect on trading than stockbrokers are doing. I think we are in a world in which some parts of medicine will become very machine-driven, but other parts won't. No machine can put its hand on your shoulder and say, David, now that you know what your diagnosis is, let me help you get through this. That is a human job, and will be for the next decade at least.
Interesting. So you think there is an empathy piece that will remain human for the medium term?
I think there is a human-to-human relationship and trust that will be there for the medium term. And I think there is a piece about just sheer computational power of a machine that humans will very shortly fall behind.
We touched on this earlier, but let's talk a little bit about accessing data in healthcare. There's this whole kind of dichotomy in healthcare where there's lots of data, and yet accessibility to that data can be a challenge. Can you describe how, as a B2C company, you overcome what's known as the cold start problem with lack of available training data?
So we had to spend almost 2 years solving that very problem you just mentioned. It takes a lot of time to take that data and then to curate the knowledge and to teach the machine. But you pass a level where you're good enough. It's kind of like you get to a level where a doctor passes its exams and you feel that you can set them free on the world, right? And after that, data acquisition becomes an incremental issue because every doctor, every consultation they do, they learn, as I said, that's why they call it practice, and that data accumulates. I think we're just about the place where we pass that, where we got enough data and have trained the machine enough to be able to diagnose for 80% of primary care diseases, as I said. And soon that number gets bigger and bigger and goes into specialty diseases. And so it'll be now an incremental acquisition of confirmatory data, if you wish.
And in the early days, I mean, just how did you get a big enough quantum of training data in those 2 years?
So we had to do a lot of deals, talk to a lot of people, scrape a lot of data from places that were freely available.
Bit of a mosaic approach, kind of overall.
From a lot of areas, because data in healthcare is incredibly dispersed and it's available in different formats in different countries. And we also had a lot of data or knowledge sits in the mind of the doctors. So we had to hire a lot of the doctors, as you know, to help us download their brain.
The phrase, it's all in the data, has become a bit of a truism in AI. I often feel that proprietary algorithms are underrated. Am I wrong?
No, you're absolutely right. The way I look at this is that if you and I have exactly the same library of books, it does not mean that you and I are as knowledgeable as each other. It's how we approach that library of books, how much we read it, how well we understood it, how well can we articulate our knowledge that will differentiate us.
Uniquely in the healthcare sector, the AI platform companies, particularly Google, IBM and Microsoft, are actually developing applications as well as platforms and tools. Are they competitors of yours? Are they enablers? Are they a bit of both? How do you think about them?
So we have not come across people in our space. So we know of nobody else who is trying to diagnose at the extent that we are, or predict your health, or assess your health, or create models of you, what we call digital twins of you, that we can simulate your future in the way we have done. But maybe they are doing this in some other part of their organization secretly that we don't know about. But I have, David, a big belief in focus. I think there are things that we can do incredibly well, better than anybody else in the world. So it doesn't faze me ever when big companies that you mentioned, who are big giants of AI, come into our space, if they decide to come. Because at the end of the day, they have to employ the same kind of people I have to employ. They have to motivate them, bring them in things. So it becomes a micro problem rather than a macro solution.
Let me talk to you a little bit about entrepreneurship more broadly. Babylon sells to consumers directly, but also to employers and insurers who provide Babylon to their end users. Engaging with large buyers is not easy, particularly for very early stage companies. What advice would you give to early stage companies as to how they can engage with large buyers to get results?
I think you must always remember that the rules of adoption of technology, that I think it was Rogers who came up with the adoption curve, that 2% of people are extreme adopters, 15% early adopters, 35% get you to, the next 35% get you to early majority, so on and so forth. It's just true. So when you do B2C, the very first thing you do is you attract those 2%. 2% of the population of London who have downloaded Babylon may sound like a small number, but it's 200,000 people, right? But 2% of people inside the hospital's hierarchy are still only 2% of the management. So it doesn't even matter if they include the CEO. The other 98% are going to oppose it or distrust it or not believe in it until you provide more evidence. So then you get to the 15% and so on and so forth. And I have this theory that big organizations will buy you en masse when you have passed that early majority stage. And until then, you will find an odd organization here and an odd entrepreneur inside an organization or an odd innovator inside a company who soldiers on and forces his organization to adopt you. But they will become your 2% in corporate world. They will become the people who will provide the references for you. And eventually, the forces of just truths, the sheer reality of what you're doing will become apparent to everybody, and then people will come en masse. We don't have time for stories, but I encourage your listeners who think our lives as entrepreneurs are tough to look into the life of Cyrus Field, who laid the first cable across the Atlantic at a time that nobody had created a cable that big, knew what's at the bottom of the ocean. He had to not only redefine the whole engineering, there was no ship that can carry a cable that big, all of those things, but in the middle of it, he had a government in the United States that went into civil war with another part of the country. He had in Britain a government who decided to create a 3-year committee to study what he's doing. And he soldiered on. And it took him 15 years, but he put the first cable that fundamentally changed communication in the world by taking the distance from what used to be 2 to 3 weeks to 2 to 3 months into 2 to 3 minutes. Once a cable was laid. We think our life as an entrepreneur is tough, but no big thing ever comes easily.
From your description, it's apparent just how significant and numerous the challenges are when trying to change things. What do you think are the personal characteristics that lead to entrepreneurial success?
I think you just need to be persistent and have a vision and a belief and work hard to get to that belief. I don't call somebody if you set up a burger shop, you are a business person. If you create something new, you're an entrepreneur. If you copy somebody else, you are again. But having a vision that you believe in, a vision of the future that you want to bring in is a belief. And unfortunately, when that gets inside you, and you believe in it, there is nothing that can stop you. That's why true entrepreneurs remortgage their houses, stop everything, put all their life into the creation of the future vision they have seen and they know they can bring in. And people say, oh, that's a really tough life. I actually think it's a lovely life. It's a brilliant life. I can't want to ever do anything else because it's a life of beliefs. And I think that our life is so much more enriched when we have values by which we live.
Slightly more pragmatic matter, if I may. Babylon's been very effective at raising large amounts of capital. I think you've raised roughly about $85 million so far, at least. Can you describe how you think about capitalization? Is capital a strategic weapon for competitive advantage, or do you think about it differently?
No, I think capital, to bring a vision to reality, you need to decide, okay, here is where I want to be. What is it that I'm going to build? How am I going to build this? Where am I going to deploy it? When am I going to deploy it? And that tells you the answer to the big question, which is which resource do I need in order to do all of that? And to pay for that resource, you need to create capital, bring capital. I'm a big believer, if you can, to the just-in-time delivery of capital as opposed to putting a huge amount in a bank and waiting for it. But I am incredibly lucky to have investors who share the same dream and the same vision, who are not short-termists, who don't want to just make 4 times their money and sell. I have employees and senior management team who are not just after a bigger house in Kensington. We all are united in a simple belief that healthcare is broken, but it can be democratized, that it can be made accessible, affordable, put in the hands of every human being on earth. And when you believe in something so worthy, it becomes infectious in other people believing in it. Then they check and see that you're not a dreamer, that you have a real way of getting there. But once you do, we never found access to capital, luckily so far, a problem, because the world is full of people with a lot of money who also have great values.
Do you think more entrepreneurs fail due to lack of ambition or unsuccessful execution?
Both. The truth is, there is this line with which Tolstoy starts one of his books, where he says, every successful marriage is successful in exactly the same way, but every failed marriage fails in its own unique way. And that is true, because to be successful in a marriage, almost everything needs to come together right. But any of those go wrong, things can go wrong.
You're in trouble.
And being an entrepreneur and succeeding has as much to do with luck as it has to do with ambition, as it has to do with execution capability. There's so many things that's got to go right for you.
Babylon's having success in a range of developing economies. Briefly, what are the dynamics of working with developing economies as opposed to more developed economies?
It has its own challenges, but fundamentally the problems are not as different as one thing. So in Rwanda, there are less doctors, but they are very enthusiastic and want to do a great job. So we have to do more with the less number of people available. There is some vested interest there that it is here. There is exactly the same amounts of ambition and desire to do good in there that it is in here. People want the same thing for their children in Rwanda that they want in UK. It really doesn't matter. What I found in life, I'm an immigrant, and I arrived in Britain as a refugee. And one of the things I found, David, is it really doesn't matter if I lived among the poor or the rich, whether I was a native or a local, whether I was in a developed country or a developing countries. People everywhere have the same dreams. They just have different opportunities.
You immigrated to the UK from Iran. Immigrants have founded 40% of Fortune 500 companies. Why do you think that is?
I didn't know that, but I think it has to do with the fact that being an immigrant is a self-selected group anyways. So you have dislocated yourself. I don't know, in my case, at the age of 15, I left my family. I walked across the globe. I got here. I'm one of these refugees you see arriving in this country. And then we put a barrier in front of them. I almost think that there is no better job interview you could do, right? This person has done everything to get to Dover. I mean, honestly, what else do we want them to do? They haven't come all this way to just collect a paycheck. They come here to make a better future for themselves and by definition for people around them and the country. So I think that there is something in the group that select themselves to do that. I also think there is something in the fact that when we arrive here, we have nothing. And therefore, when we take a risk, it's not as if we are going to lose anything. And then once we have built things, I always look at myself and say, well, what happens if I lose everything? I've been lucky, I've got enough today. But if I lose everything, I'll go back to where I was when I first arrived. And actually, it wasn't that bad either. I had a great time as a youngster in this country. So you actually learn not to be afraid, because it's not as bad as you want things. So if you were born in a certain level of comfort, and if you haven't had what Malcolm Gladwell calls desirable difficulties in your life, then sometimes you just self-censure yourself out of opportunities because of fear.
Is Brexit having an impact on your business?
So far it hasn't, but I am an immigrant and I'm a believer in unity and in movement of people and in transfer of ideas. And I can't imagine how a less open Britain will be a better Britain. But I may be wrong. I have often proved wrong in my life.
We're about out of time. Ali, I wonder if we could finish with our traditional quickfire round. I've got 6 or 7 questions, maybe just 1 or 2 word answers each, please. Firstly, is the promise of AI overhyped?
No.
Beyond healthcare, in which sector do you think AI will have perhaps the most profound impact?
Every single sector you can think about, artificial intelligence will change.
Do you think AI will destroy more jobs than it creates?
In the short term, absolutely.
Should we worry a lot about autonomous weapon systems?
Absolutely. And not just about that. As somebody who is engaged in this industry, we should be incredibly careful about the creation of artificial intelligence. And it's because we just don't know the unforeseen consequences it can have. It is developing much faster than we can think about. And those who say it can be an existential threat to humanity could be very right. And equally, it could be the biggest liberating thing for humanity too. But it could go either way, and it is up to us to manage it right.
This is too fascinating for me to just go to the next one. I know we're nearly out of time. Could you just tell me a little bit more about that? The nature of the existential, I think the nature of the opportunity, I think is pretty well understood. What worries you about the other path?
Everything. Look, imagine the way we train an agent, and take a theoretical solution where you create an all-empowering machine and you say, look, make sure that our planet is at its best thing, right? And this machine had all the capabilities and figured itself out that actually the biggest destroyer of the planet is humanity. What should we do there? Imagine we change that and say, okay, your job is to make sure humans thrive at the best possible, most optimal way. Well, again, maybe if we reduce the number of humans, the rest of them will have a better sum game. You just don't know how these intelligence that is becoming so superior, so capable, and so connected, and now mixed with all sorts of mechanical powers, can do to a very, simple alternative, which is the humans on the other side. So I think we should be incredibly careful. This is not an all-gain endeavor.
Last two quick-fire questions. Do you think we'll achieve the so-called AI singularity when general AI triggers a period of perhaps unprecedented technological change?
I come from the Middle East, and in the Middle East they say if you want God to laugh, you give him your 2-year plan. I have no idea, but it is one of the possibilities. But there are many, many others.
And finally, should AI systems of sufficient intelligence have rights?
Should any intelligence have right? Of course we do, right? What's the difference between a human being and a machine of equal intelligence or even superior intelligence and feelings? And what are we? Our brain is a neural machine, right? So I actually also think that as somebody who's got animals have a huge amount of intelligence, not at our level, but at lower level, but often with no rights and treated as slaves, right? So I think that is a profound question for which we don't have time, but every kind of intelligence should have the right not to be tampered on.
Ali, this has been a great pleasure. Thank you for your insight.
Thank you so much, David.
We hope you've enjoyed this episode of MMC Ventures Beyond the Hype podcast, presented in association with Barclays. Follow us on Twitter at MMC_Ventures and explore our research at mmcventures.com. Don't miss our next episode, Fixing Finance, where leading executives from Barclays, Director of Strategic Transformation Stephen Roberts, and Head of Data Technologies and Machine Learning, Rob Otter, describe the opportunities and challenges of deploying AI in a financial services organisation that touches a third of the population every day.